How can overflow incontinence make it hard to start urinating? Imagine trying to turn on a faucet that's partly blocked or clogged. That's similar to what happens in overflow incontinence when it becomes difficult to start urinating. This condition usually occurs because the bladder isn't emptying properly, leading to urine buildup and a feeling of fullness. The main reason is that either something is physically blocking the flow or the muscles responsible for pushing urine out aren't working as they should. One common cause is an obstruction in the urinary tract. Conditions like an enlarged prostate in men, bladder stones, tumors, or scar tissue can partially block the urethra, which is the tube urine passes through. When the urethra is blocked, the bladder has to work harder to push urine out, but it can't do so easily. This resistance causes urine to stay in the bladder, stretching it beyond its normal size, and makes starting urination a challenge. Another key factor is the weakness or underactivity of the detrusor muscle, which is the muscle that contracts to empty the bladder. If this muscle doesn't contract strongly enough, perhaps because of nerve damage from diabetes, spinal cord injury, or certain medications, the bladder can fill up without being emptied. This leads to urinary retention, where urine remains in the bladder, causing difficulty in initiating urination. Nerve damage or dysfunction also plays a significant role. The nerves that signal the bladder to contract or the sphincter to relax can be impaired by conditions like multiple sclerosis, diabetes, or after pelvic surgeries. When these nerves don't send proper signals, the coordination needed to start urination is lost. This results in hesitancy or an inability to begin urinating smoothly. Overdistension of the bladder is another factor. When the bladder remains overly full for a long time, it stretches beyond its normal capacity. This stretching can weaken the bladder muscles and reduce their ability to contract effectively. It also dulls the sensation that tells you it's time to urinate, making it even harder to start the flow. In cases related to bladder health, overflow incontinence can be a sign that something is blocking or weakening the normal process of emptying the bladder. If left untreated, it can lead to complications like urinary tract infections, bladder damage, or even kidney problems. In the context of bladder cancer, tumors inside or near the bladder or urethra can cause physical obstruction, contributing to overflow incontinence and difficulty in starting urination. In summary, overflow incontinence makes it hard to start urinating because either a blockage in the urinary tract or weakened bladder muscles prevent the bladder from emptying properly. This causes urine to accumulate, stretching the bladder and making the initiation of urination difficult. Addressing the underlying cause, whether it's relieving an obstruction or improving nerve function, is essential for restoring normal urination. If you experience these symptoms, it's important to consult a healthcare professional for proper diagnosis and treatment tailored to your specific situation.